Okay, so here we have the nice gentleman we talked about, and I'm not showing you his whole face to protect his identity because he has a potential Hollywood career coming up and we don't want to mess it up. So all the agents are looking at him right now. So he's smiling, and that helps me to see when he smiles, it really it gives me the direction of the lines, and that's what we have to follow. And that looks great. So let's go on to the other side, see what we can see over here, and there we go. And these acne scars, I have learned from patients, are very tricky because a lot of times they show me and I'm like, really, we can't do anything, it's not that bad. But what happens is the patients with acne scars, they catch a certain light, certain angles, and then it looks horrible. So for me, and not only that, there's a daytime variation, like in the morning it looks bad, at the end of the day it might be better. So I have to literally rely on the patient to mark and show me where it is the worst. And then we are able to make sure we get a good result. So I'm going to have him smile so we can have a good result on this side, and you can see. Fantastic. So I'm sure you're thinking like, there's not much going on, but trust me, in his mind there is, and we gotta do what he wants, not what we want. Okay, so we are all done. As you can see, there's a pull on the oral commissures, equal on both sides. And now you can see the whole area has been closed without tension. And let's get a little closer. You can see the raised areas, and that's exactly what you want from the side view as well. If you pay close attention, you can see right there. And the same thing on over here as well. I'm going to show you with the tangent little angle, and there we are. That's exactly what we want. So we are 5 days post-op. The steri strips have come off, and as you can see, the incision lines are healing really well. You still have the sixoplane, but that's falling off very nicely. And also, if you notice, the oral commissure pull that we had right after surgery, that's gone. So at the time it looked very disconcerting, like wow, that's such a huge pull, but it was partly because of the local anesthesia, and that's worn off, and here we are. So you can see the recovery is going really well. I mean, there's yellow bruising and stuff, but that'll go away pretty fast, and these incisions are going to heal really well. And then the stretching effect will flatten some of the acne scarring as well. And once we start the laser, that's going to be really, really good. So very excited. I'm so glad this nice young man is going to be on the road to recovery. We'll keep you posted. He's very good about it. Okay, so we are 3 months post-op. This is a good landmark. By this time, the healing is in a good place. It continues to get better, but you can already see there's no cover-up or anything covering, and it's healing really well. It's blending really nicely. There's no widening of the scar, and there's some erythema that will settle down over time, and that is very encouraging. So let's go on and take a look on the other side as well. And we have done 2 sessions of resurface. Today is going to be, I think, the 3rd one. So same here on the right side, looking great, healing really well, blending in very nicely. So we'll continue with the resurface laser. In an ideal world, I would say 5 sessions are good. After that, maybe I'll switch the patient over to microneedling, and ideally if you can do microneedling with PRP, that's even better. So there we go. I'll keep you posted.